Dear friends and colleagues, welcome back to the Mangano Digital Academy and to the Essentials of Digital Dentistry. Today we talk about the data acquisition phase, and we talk about beam computed tomography again, and in this short lecture we focus our attention on the resolution of acquisition of beam computed tomography. But before to talk about it, let me summarize a little bit the most important 4 phases of the workflow in digital dentistry in the different, possible clinical application: prosthodontics, surgery, orthodontics. We have a scan phase with the data acquisition of our patient, 3D data, through beam computed tomography, of course, for the bone, for the hard tissues, but also intraoral scanners, face scanners are used, digital condylography. We go from the real to the virtual. Then in the virtual world, in the world of software, orthodontic computer-assisted design software or prosthodontic computer-assisted design software, and even in surgical software, we have to elaborate this data, and then these data are used to model some device. These devices or object. This device can be a crown, a bridge in prosthodontics, but also a surgical guide, or in surgery, for surgery, or an orthodontic device. Then when we have modeled these devices, we need to physically make them through different machines like milling unit, 3D printer, and after that we can use these devices or apply these devices in the clinically for the last and 4 phases, the clinical application. When we talk about beam computed tomography, we are talking, of course, about the scan phase, so the first phase of the workflow, and we talk about really a game changer, because this machine appeared in the late 90s and they changed completely the way we treat our patient, because they changed our diagnostic capability and accordingly the possibility to make very accurate treatment plans for our patient. We can see our patient in 3D, in 3 dimensions. They opened the door to the 3 dimension and they are game changers. And it's not surprising that these machines are spreading across the world, and we can find now this machine in almost all dental offices. But sometimes there is confusion about the terminology, sometimes not all the basic concepts are clear. So the question today is, what is the resolution of acquisition in a beam computed tomography? We need to consider the working principle of beam computed tomography. During a CBCT scan, the scanner rotates around the patient's head, obtaining a sequence of distinct images. Then the software collects all these images and reconstructs them, producing a digital volume composed of 3D cube. We talk about isotropic voxel, and the size of the voxel basically corresponds to the spatial resolution, and it is intrinsically related with the pixel size of the detector. So the resolution of acquisition of beam computed tomography is usually in the order of 0.09 to 0.4 millimeter, depending by the machine. Some modern machine, they have a voxel that is even 75 micrometers, so very, very little voxel. And spatial resolution is the ability to discriminate very small anatomical structures. So the high spatial resolution is a feature that distinguishes beam computed tomography, for example, from conventional medical CT, particularly with regard to the hard tissues, so teeth and bone. And this was immediately evident from the first studies we made in the early 2000s. And this is one of the most important features of beam computed tomography, because we have an incredible diagnostic potential. For example, we can discriminate very well small endodontic lesion or small periodontic lesion that was not possible to see even with the medical CT. And you can see this here. This is a very old picture from many years ago, and you understand immediately that we have an higher spatial resolution with beam computed tomography when compared to the conventional medical CT. So what's this spatial resolution? Basically is the voxel size. So the high spatial resolution of beam computed tomography is linked to the size of the voxel. So the voxel is the elementary unit of volume information represented in 3D. It represents a signal intensity value in a 3D space. So it's similar to the pixel for 2D, but here we are in 3D. the voxel is a volume in which two dimensions are those relative to the pixel, and then there's a third dimension, the thickness. So we can say that the smaller the voxel, the higher the spatial resolution, and so the ability for us to discriminate between small anatomical structures. It's very important. And this is one of the basic concepts when we talk about combined computed tomography. So combined computed tomography can generate very small voxels up to 75 micrometers, and it is not possible to compare this spatial resolution with the resolution of conventional medical CTs. So this determines the high spatial resolution and the high quality of the images with CBCT. And when we talk about CBCT, we talk about isotropic voxels. So this basic unit, that is the voxel, normally in CBCT has the same dimension in the 3 dimension of the space. This is an advantage over conventional CTs because it allows the software to reprocess quite easily the images and represent them with different multi-planar reconstruction. And these multi-planar reconstruction are virtually distortion-free. So we can make measurement, for example, in the different multi-planar reconstruction without losing quality. And here we can see the difference between a single slice medical CT versus the combined computed tomography. In the combined computed tomography, the voxel is isotropic. In the medical CT is anisotropic. So that's it. This is the voxel. The volumetric data from combined computed tomography are isotropic. It means that all the voxels are effectively cubes with the same dimensions. So it is possible to reorient the images and to investigate the patient's anatomy on different planes. This is a great advantage with combined computed tomography, and the software can reconstruct different multiplanar reconstruction without any issue, without losing any data, without problems. And it's quite important. Let's see a few cases in which the combined computed tomography is a very valuable tool for the diagnosis. For example, in this case, when we have an oro-antral communication after tooth extraction, it may happen. It's quite, common. We have in this case a CS9300, a FOV of 5 per 5 centimeters, and a high resolution of acquisition of 90 micrometers. And we can see the quality of the image and the 3D rendering that we can see from this scan. And we can perfectly find, exactly locate the oro-antral communication thanks to the software, to the reconstruction software, with the different multiplanar reconstructions. For example, it's not the purpose, of course, of combined computed tomography, of course, but we can also see, particularly if we don't have scattering from metal or metallic artifacts, we can also see deep caries with this kind of high resolution of acquisition with this small field of view with the same machine, as you can see here. So of course it's not the purpose, it's not the case, but if we reconstruct the volume with a volume rendering of the software, we can see that we are capable to see and discriminate very little structure, like for example caries, in different reconstruction and very clearly. But also it's very important for small periodontal lesion and periodontal evaluation. These are only a few examples of the importance of the resolution of acquisition. If you want to have a very high resolution of acquisition with this machine, the CS9300, you need to select a small field of view, 5 per 5 centimeter, in order to have the possibility to have a resolution of acquisition of 90 micrometer. And here we can see that it is possible really to make a very good evaluation of the periodontal status of the patient, and also the 3D rendering helps us a lot to understand the relationship between the teeth and the bone, and where the bone is located, and the integrity and the periodontal problem, in this case the periodontal lesion. And it's very important, for example, if we want to plan some treatment, some periodontal treatment or some other treatment to gather all this information. We can rotate, of course, the model, and so we can have the perfect diagnosis thanks to the high resolution of acquisition into the images, but also the complete overview of the situation using 3D rendering and 3D images. So in conclusion, when we talk about resolution of acquisition, in beam computer tomography, we are talking about the voxel size. So the smaller the voxel, the better it is possible to discriminate small lesions, for example, endodontic or periodontal lesion. And this is possible using a small field of view with a high resolution of acquisition. That is a very powerful tool for diagnosis. Today, beam computer tomography can generate very small voxel size, up to 75 micrometer. Of course, we don't have to forget that a high resolution acquisition means also a higher dose for the patient, and sometimes in very different application. In the last year in particular, the clinicians are trying to reduce the dose, searching for low dose protocols, and low dose protocol anyway can allow to make a proper diagnosis and to plan the treatment well. So we need to discriminate between the different situations because it's important to balance our treatment. Thank you very much for your attention, and please stay in touch with me if you want to write me. My email is there. Thank you.